When I see a breast augmentation consultation, the biggest question is, how do I know what implant size is going to work for my body? And the fact is, implant sizes go by cc's and not by cup size. And every size looks completely different in every patient because it depends on just unique anatomic traits that an individual has. So it depends not only on height and weight, but also on the thickness of the muscles and how much breast tissue is there and how tight are their tissues or how loose are their tissues. And all those factors can make a big difference with respect to how a breast implant size will look on a person. The biggest factor, however, in picking an implant size that goes with a person's body and fills out some of the spaces while providing a beautiful cleavage that's natural and not too far apart is to take a measurement of the breast width of a patient. Because it's very important that the width of the implant sits within the width of that breast. You want a certain amount of width to fill the spaces and close the gap in a cleavage, and you also don't want excessive width where the implant may have a tendency to stick out to the side. So the implant sizes go by cc's, and I tell patients don't get too worked up over 25 cc differences, because if you think of what a cc is, 5 cc's is a teaspoon, and if you talk about 25 cc's, you're talking about 5 teaspoons in a big space, and those values end up being irrelevant. So we take into account the patient's goals and what they want for cup size, because cup size is ultimately the most important thing. It is true that most women wish they'd gone bigger. And by the same token, we also want to maintain a very natural looking breast that will be long lasting for a patient.